Now coming to the cardiopulmonary interaction. You are spontaneously breathing. Okay. What happens to the pleural pressure and what happens to the right ventricle and what happens to the left ventricle? During inspiration, there is a negative pressure. Your pleural pressure comes down, your RV stroke volume increases, the RV preload increases, but your LV preload comes down, your LV stroke volume comes down, your mean arterial pressure comes down. This happens with inspiration. And exactly opposite thing happens with expiration. Expiration, your RV stroke volume comes down, your RV preload comes down, but LV preload and LV stroke volume and the mean arterial pressure increases. Your LV volume is increased and RV volume is decreased with expiration. This is in spontaneous breathing. Now coming to a case where you give a positive pressure ventilation in the alveoli. What happens during inspiration? Here inspiration, your pleural pressure is positive, your RV stroke volume is decreased, RV afterload is increased, RV preload is decreased and your LV preload is increased, afterload LV is coming down, LV stroke volume is increased, your mean arterial pressure is increased. This is at inspiration. Your LV volume is increased, RV volume comes down. This is with inspiration. Then what happens with expiration? Here you can see your RV stroke volume going up, RV afterload coming down, RV preload increases, LV preload comes down, your LV afterload increases, LV stroke volume comes down and your mean arterial pressure comes down. This happens. So you have spontaneous, you have mechanical. What happens during inspiration? What happens during expiration? These are the findings which happens with mechanical ventilation with inspiration. Okay. Your pleural pressure is positive, transpulmonary pressure is positive, RV preload comes down, RV afterload increase LV afterload, increase LV preload, your right ventricular ejection comes down, LV ejection increases. In inspiration, the systolic pressure, pulse pressure, aortic blood velocity is maximum at the end of inspiratory period. Now with expiration, your LV preload decreases, your LV ejection decreases. Your systolic pressure, pulse pressure and aortic blood velocity is minimum during expiratory pressure. This is the inspiration and this is the expiration with positive pressure ventilation. Now to sum up, what happens to the blood pressure with spontaneous ventilation? There is a slight fall with spontaneous ventilation which is less than 10 millimeter of mercury. Here the blood pressure fall with spontaneous ventilation is due to increase in LV afterload, decrease in venous return, dependence on ventricular interdependence. How does the septum move towards the left ventricle and the transmission of reduced intrathoracic aortic pressure to the extrathoracic vessel. This is the cause for hypotension with spontaneous ventilation. What happens with positive pressure ventilation? Here the blood pressure is greater than 10 millimeter of mercury. Here there is reduced LV preload, reduced RV preload and your RV afterload is increased. Increased PVR and RV impedance is increased and finally the septum is pushed towards the left and causes hypotension.